Sophia, welcome to the Flawless Growth podcast. Could you start by sharing a bit about your journey and what led you to your current role?
Yes, of course. My name is Sophia Leverson. I am the executive director of the Sickle Cell Disease Association of America, Central Alabama chapter. I always tell people that I don't really remember a time that sickle cell wasn't a part of my life. So I grew up in South America. I was born and raised for the first 7 years of my life in a small country called Guyana. Both of my parents are physicians. And so I took my first steps in their clinics where I interacted with people with sickle cell. When we moved to New York, we moved to the Bronx for 3 years. Then I found myself settling in Alabama. I went to college at the University of Alabama at Birmingham, and I was a biology major there in in evolutionary biology specifically. And in one of those classes, we talked about sickle cell, and I did a research paper on it. And so I guess sickle cell has always sort of been a part of my life. But in terms of past positions I've held, I've been an epidemiologist for the health department here in Jefferson County, Alabama. I've also worked for Children's Hospital as a data analyst, and I also have had my own business teaching people how to swim.
Oh, nice. Doing a lot of different things.
Yes,
Yeah,
absolutely.
that's awesome. And for people that maybe don't know what sickle cell is, could you explain in your words?
Absolutely. So sickle cell is a hereditary disease that turns our regular round shaped blood cells into a hard crescent shape, sort of like a crescent moon. Those blood vessels can get stuck in the body and cause very painful crisis. It actually gets worse during times of extreme temperature, so extreme heat or cold. It is an inherited disorder. You get one trait from your mom, one trait from your dad. And so that leads to people with sickle cell disease. However, sickle cell disease is currently without a cure. There is an extremely promising treatment on the market right now. However, it is $3.5 million without insurance. Insurance does not currently cover any of it. So it is out of reach for the vast majority of people.
Mhm. And what does that treatment consist of?
So that treatment is a gene therapy treatment with CRISPR technology. I'm actually not the person who's best to speak on it, but that treatment was developed right here in Birmingham at UAB. Dr. Julie Cantor was a very big player in that realm, and I actually recently got to meet someone who received the treatment during that study. And she says that she has been able to live a life as close to normal as she's ever known.
Oh, wow, what a blessing.
Yes, absolutely. And I wish that blessing was more accessible to other
100%.
people with sickle cell.
Yeah. And for the people that have it, I know there's no cure, but what changes in their lifestyle or anything that they can do to, I guess, live a better life with those issues?
Yes, so there are several things. We always encourage people to hydrate. Hydration is very important for everyone, but especially important for people with sickle cell disease and for sickle cell trait as well. So we try to emphasize hydration, good nutrition, taking your medicines, following up with your primary care physicians. Um, and it sounds basic, but it is very pivotal to the way that people with sickle cell can live their lives. And it makes a big difference. We also encourage them to avoid extreme temperatures, avoid extreme heat and cold. If it's too hot outside, like in these summer days, make sure that you have an air conditioned environment that you can go to, and vice versa. If it's cold, make sure that you have a heated environment that you can go to. And we also encourage them to lean on their support system. That can come in a bunch of different forms. It can come in the form of their healthcare team. their families, their friends, and also community based organizations like our own.
Got it. And this is something that since they're kids, they realize, or is it a little bit more like when they become adults?
So actually, several years ago, it is mandatory in the state of Alabama, as well as, to my understanding, around much of the United States, that every baby that is born is tested for sickle cell disease
Oh,
or
wow.
trait. So I recently had a baby about a year ago, and they were tested
Mhm,
for sickle cell
mhm.
disease or trait. So that is a mandatory thing now. However, it was not always the
Mhm,
case.
mhm.
So, for some people, they have found out at varying stages of their life.
Right.
Some people found out when they were young children. Some people found out when they were adults. Some people found out through military service that they had sickle cell disease or trait. So we're really trying to work on making sure that more people talk to their family members and know what their trait status is.
Okay. And when they hit a crisis, what can this crisis look like?
So crisis is an extremely painful event.
Okay.
So it can have sort of acute chest syndrome where they get severe pain in their chest.
Mhm,
They
mhm.
can get pain in their internal organs because those shaped cells can get stuck in those veins and arteries. Um, it can lead to strokes. We have seen
Wow.
people with sickle cell have strokes at very early ages. And it's just in general a very painful and unpleasant thing to happen.
Understood. Okay. And now talking a little bit more about the your master in public health. How does this master has shaped the way that you approach leadership in a nonprofit space?
Oh, well, my master's has changed the way that I approach everything.
Okay.
Um, Public health is a very particular field in that if it is working, it is silent. So, public health touches absolutely everything that anyone does. Um, the reason that you are able to go to a hotel and there are no bed bugs is because of public health. It's
Mhm,
because of health
mhm.
inspections and making sure that restaurants are storing food at proper temperatures and cooking things the right way. It's the prevention of disease, and so it has really challenged me with this population because I was educated a lot during my master's on the social determinants of health. And people with sickle cell disease often live in tough spots in these
Mhm,
social determinants of health.
mhm.
So many of them, because of their disease, they become disabled. Many of them are not able to work in the same sort of conditions. They require very specific conditions to be able to live pain free or normal lives. Um, and in my work, what I've been able to do is I've been able to think differently because of my master's in public health. So one of the things we started recently this year was the Grown program. We started it on April 19th, and what it is a small urban garden that is right next to our facility. I tend to it every day. Growing up in South America, my family has always had gardens, and so I took that knowledge and applied it to being able to provide produce for free to people with sickle cell
Oh,
disease.
nice.
So they're able to come here, make an appointment, and come and pick whatever herbs or veggies or fruits from our garden. We have okra, cherry tomatoes, squash, zucchini, strawberries, blueberries, onions, jalapenos, sweet peppers, okra, and a bunch of other things.
Mhm,
So, and then several herbs like basil, sage, parsley, and oregano, things like that. And so people are able to come and get free organic produce because, again, nutrition is one of the things that's very important when you
mhm.
have sickle cell disease. But it can be hard to access good, healthy food on a budget.
Right.
Right. And so this was my solution to that problem. So while it's not necessarily something that is very common in the sickle cell space, I was able to think about it that way because of my interdisciplinary
Mhm.
background as public health.
Very nice. I love it. And yes, it's very hard to find good food. And not just budget. Sometimes in America, the food system has a lot of hormones, it has a lot of pesticides. So sometimes people don't even know when you're buying a lettuce and you think it's good, but maybe you're buying it, I don't know, in Walmart and it's full of pesticides and things that you don't know.
Exactly. And so we try to use an as organic as possible
Mhm.
methodology. So we use a lot of neem oil and marigolds and companion planting to be able to try and make sure that we're able to provide the highest quality produce for our clients.
Very good. It's like going back to the basics, to the beginning.
Absolutely.
And this is a way that you guys help that it's very interesting. What are other ways that, or other projects that you guys do to help the people that have sickle disease?
So one of the things that we do that I'm the most proud of is that we provide free transportation to all
Mm.
medical appointments for people
Oh,
with sickle cell. So
nice.
because sickle cell is a blood disorder, it affects everywhere in your body where there is blood.
Uh-huh.
And there aren't very many places in your body that don't have blood.
Yeah.
So we don't tell them you can only get free transportation to your sickle cell appointment, right? When blood pumps through your heart and your brain and all of your organs,
Okay.
right? So we want to make sure that they have access to the care that they need. Transportation in Alabama is a huge barrier for everyone seeking healthcare, not just people with sickle cell disease. And that was something I was very aware of, even from my days working at the health department, because it
Mhm.
was my job to compile statistics. And so some of those statistics were about the um, the drastic need for reliable transportation as it relates to access to healthcare. So that's one of the
Mhm.
things that we provide. We also provide psychosocial support. So we have group counseling. We pay for three individual sessions of counseling. We also have scholarships for our sickle cell kids to go to college or trade school.
Mhm.
We have programs like our arts therapy program for our adults, which gives them a safe environment to be able to express themselves. Uh, we have we have rent and utility assistance. Um, we have mentorship programs like our I Am Pretty Enough program for our young girls, 8 to 15. That is a tough age for young girls in general across the board, but especially when you have a chronic condition that causes you so much pain that a lot of people may not understand fully. So we're very honored to be able to provide those programs and, of course, many others to our clients. And so we provide a myriad of services here. And basically, our mission is until there is a cure, we help our clients live the best way that they can.
Mhm. Amazing. And what are some of the key challenges that the organization faces when raising awareness about this disease?
I think a lot of it is fighting stigma and stereotypes.
Mhm.
So a lot of people think that sickle cell disease only affects the Black population, and that just isn't true.
Mhm.
Actually, the second biggest population it affects is the Hispanic population,
Mhm.
and it affects Asians, it affects Southeast Asians a lot, it affects Middle Easterners, it affects Europeans, especially those with Italian ancestry, and so it affects everyone.
Mhm.
This is a disease that affects everyone, and so I think that that is a huge barrier that we face. There is some misinformation in the community about some people believe that only women can have sickle cell disease, and it affects women and men in fairly equal measures.
Okay.
Um, it's something that is extremely um, hard to fight misinformation on, and there are some people who believe that because of circumstances out of someone's control, they might not, deserve help as much as someone who seems to be approaching it a different way, right?
Mhm.
But that's just not the case. And people who have sickle cell disease, they didn't ask for it, and
Yeah.
many of them would not wish it upon their worst enemy. It's extremely painful, and it is hard to live with this condition. And so I think that that is a major obstacle for us as well. I think every nonprofit will talk about funding, and how that is always an adventure, to say the least, to seek out funding, and what's going to work this year may not work next year,
Uh-huh.
and shifting priorities and things like that. So I think that that's prevalent across the nonprofit space. That's not necessarily unique to us.
Right.
Um, but I think one of the other things that we can do a better job with is getting out and reintroducing ourselves to the community and making
Mhm.
sure that sickle cell is still a priority.
Mhm.
Um, there has been a lot of, there's a lot of diseases, there's a
Yeah.
lot of causes. How do you make yourself stand out in a world where there are so many people who need help?
Right.
Right. And I think that is a challenge for everyone. We certainly wish that we could help everyone. Um, this is just our little corner of the world to try and make a difference.
Correct. And talking about like funding and partnerships, how do you guys usually engage the not just local community but the community overall and partnerships or programs?
Sorry, could you repeat that?
Yeah, how do you engage the local community or engage partnerships or programs to help with the cause?
So, developing and maintaining partnerships is honestly something that that I greatly enjoy, and I
Mhm.
think my team greatly enjoys.
Mhm.
A lot of these partnerships are legacy partnerships, so they have been with us for a long period of time,
Mhm.
and so those are people like P Dive Temple 16, like Omega Psi Phi, the chapter here in Birmingham. They have been loyal to us for quite some time, and so it's about nourishing partnerships like that that have been around prior to my leadership here. It's also developing new
Mhm.
partnerships and new partners and trying to decide who would be a good partner for us. Because just because someone's doing great work in the community, they may not be aligned with what we are trying to do. So,
Mhm.
evaluating that process and seeing who is a good partner, who's going to do what they say that they're going to do, who's going to fulfill their promises. Our community in particular is very um, they've gone through a lot, to be honest
Mhm.
with you.
Mhm.
I mean, they've lived their entire life with this chronic condition. They have had people turn their backs on them. They have had research turn their backs on them.
Mhm.
They have had medical professionals who just didn't understand what they were going through. And so, if we are going to take on new partners, we go through an evaluation process where we really think to ourselves, does this partnership have our client's best interests at heart? And if so, then we take them on as a partner. Um, if we like what they're doing, but we may not have a way to fit them in, if we have a community event, like we're about to have our open house on September the 9th, because September is Sickle Cell Awareness Month.
Okay.
So we will have a big community event here. And if we have someone where we like what they're doing, we can't think of a way for them to directly partner with us and our clients, but we think that they would be useful to our client families, possibly. We invite them to events like that and make sure that they're visible within our community. So that, because I think partnership works in many different ways, right? And so you have to be able to honor different aspects of that partnership. And you have to constantly be evaluating what is best for the people that you serve.
Yeah. Correct. Okay, beautiful. And can you share with us some of the wins that you've had since you stepped into this role?
Some of the what I've had?
Some of the wins or one win, whatever that you can that
Win.
you're proud of. Yeah.
I mean, I I've been proud of a lot of things
Mhm.
in my time here. This is my first time being an executive director. So I've put my heart and soul into this position,
Mhm.
and there are lots of things that I'm very proud of. For instance, last year we had our very first open house. Um, it was a big event with education about sickle cell and a community health fair and a blood drive and a bouncy house and a DJ, and just a fun way for the community to get together and to learn about our cause and to hear client testimonials. We had an adorable little client who shared his testimonial, and then we had a client in his 50s share his testimonial. Um,
Love it.
and so it was a beautiful experience of everyone coming together. And then our past two walks for sickle cell, which we usually have those in June, as World Sickle Cell Day is June 19th. We usually try to have it in June to commemorate that.
Mhm.
Um, the first walk I did, I actually gave birth 3 days later.
Wow.
So I'm very proud of
Yeah.
myself for being that pregnant and still executing the fundraiser.
Totally.
And then it was very special this year because my daughter had started taking her first steps right before the walk.
Aw.
So this year she was able to take her first steps at that event
I
that she
love
was
it.
born so shortly after.
So
So
cute.
that was really wonderful, and
Mhm.
we actually got it on the cover of the Birmingham Times
Mhm.
at that walk this year. The Mayor Woodfin came to the walk, and so it provided a lot of visibility for the cause, which
Mhm.
I
Totally.
definitely really think that we deserve
Mhm.
to have that platform. And for me, um, what I personally believe is that it should be client facing. So my job is to provide a platform for our clients to stand on and share their story.
Mhm.
So it's not my job to speak for them.
Mhm.
It is my job to advocate on their behalf. But in terms of me, I make sure that I hand them the mic every chance that I get. So for our article in the Birmingham Times, I reached out to two of our warriors and asked, would you share your story? And they did. There was a
Mhm.
whole article written on what they experience. And we just had a ride for sickle cell on Sunday. And during that, we had a young warrior. He is 13 years old.
Wow.
He rides and he'll be street legal on his motorcycle next year, so he's
Ooh.
very excited about that. Um, and so he was able to give a speech, and the people who were there were able to see and meet and interact with people who
Yeah.
have sickle cell. And for me, that's very important because there are many fundraisers that you go to where you go, you raise money, and but you don't meet someone who can give you a different perspective on it. And so for me, I want to make sure that my warriors always have a chance to tell their story. Um, because in as much as I've read and as much as I've heard, I don't have sickle cell disease.
Correct. Mhm.
And so I want to make sure that I don't misrepresent any part of their journey, even if I mean well.
Mhm. Correct. Yeah, I think there's
Correct.
nothing
Yeah,
better
I think
than
there's
if you
nothing
have a
better than
condition, getting to know other people that
condition
have
getting
it,
to
because
other
they really are
they
the only ones who
they really
completely
are
get it.
get it.
And
And
I'll, like for example, I have
like for example, I have
chronic pain,
pain,
and even when you go to the
and even when
doctors
you go to
and
the
they
doctor,
kind of
they
understand, they
kind of
don't really
understand, they
understand,
don't
right?
really
So being
right.
able to talk with
So
other people that
talk
have
to
gone through
people that
chronic pain,
gone
it's
through
been
pain
such
been
a difference.
such
It
a
really helps a
difference.
lot.
Really
And I'm
helps a
sure
lot.
this is the
I'm sure
sickle
this
cell
is
is a rare disease as well.
rare disease as well.
So
So
meeting
yes,
other
it is.
people, yeah,
Meeting other
exactly. Which so
people,
it's
yeah,
harder to
it's quite
to
harder
meet other
to
people with
meet
this.
other people with it.
And absolutely,
And
it's great that you guys,
absolutely, it's
even person
great
to
that you guys
person
in
event, that
person
helps
event
out a lot.
that helps out a lot. Yeah, I definitely want to. I want to make sure that they're included in every step of the process. So, for instance, for the ride this weekend, we had these giant checkered flags that we were holding up for the start. They were like 12 feet tall.
Mhm.
I had two warriors
Oh.
holding those
Oh.
on either side of the street, and then to wave the flags for the start, I had a flag, and then our young 13-year-old warrior had a flag.
Mhm.
And so he got to wave it to help start the race.
Oh, nice.
And so I think just like having those meaningful moments where they get to be an active part of an event that raises awareness for them, I think that means a lot.
100%. Okay, and now talking a little bit more about the nonprofit world. What do you think are some skills that are super important to work or manage a nonprofit?
Cool. A lot. There is a lot that is needed to manage a nonprofit.
Uh-huh.
Um, and and I will say that I am still learning. I have the benefit of I have a board who is very directional with me, and they do a great job of guiding me.
Okay.
I have a support network of other executive directors in the state. A lot of our other executive directors of the other 5 sickle cell disease associations within the state of Alabama, because there are 6 total.
Oh, wow.
They are all very helpful and wonderful, and they've all helped me on this journey to be an executive director. We are a United Way partner as well. The United Way has put on lots of free trainings, and I have been at so many of them. It has been unreal because I try to learn a little bit of everything. Because when you're an executive director of a nonprofit, especially a small nonprofit, you have to be a little bit of everything. You
Yeah.
have to be a little bit of social media. You have to be a little bit of in well, a lot of the finance
Mhm.
portion of it. You have to build a team. You have to build a community, and there's no one right way to do that. There's a different roadmap for everyone and the cause that you're in. So definitely tailor it to that. I think one skill that everyone needs is adaptability. Things with nonprofits change all the time, especially in this day and age.
Mhm.
So the ability to think on your feet, to think in interdisciplinary ways, that's a big one for managing nonprofits. Also, professional development is definitely needed. I try to attend the National Sickle Cell conferences
Mhm.
every year so I can learn what is new in sickle
Mhm.
cell, what's going on in our field of work. And then also, I'm in the Nonprofit Executive Leadership Institute with the Alabama Association of Nonprofits. And that goes through a lot of aspects of leadership profits. So I think the skill above anything else, if you are brand new, just like I was, um, is is the desire to learn and do what it takes. You have to be a lifelong learner in this work. Things change all the time with causes, with diseases, with nonprofits, with the world that we live in. Things are constantly changing, so you have to be willing to constantly learn. And I think that yes, finance is so important.
Mhm.
Governance is so important. Making sure that you have your paperwork in order, that is so important. I cannot stress that enough. There are a million things in the nonprofit world that you have to have your ducks in a row.
Right.
However, what you need above anything else is a mindset that you are willing to learn and you are willing to advance yourself for the betterment of your organization.
Correct. Beautiful. And you mentioned that you can wear a lot of different hats. So, talking about that, let's talk a little bit about digital marketing. Do you have any involvement with digital marketing at this company?
I have a little bit.
A little bit.
So in the past, I was a social media intern for
Oh,
the 1917 clinic,
okay.
which is an HIV clinic here in Birmingham. So I was their social media manager for a little while.
Nice.
So I but we have a very talented office manager who also does social media for a bunch of different organizations.
Okay.
So she's the one who manages our social media. But that that being said, all of us bring ideas to the table. I have tried my best to create a collaborative environment with my team.
Mhm.
So all of us bring different ideas to the table. I try not to plan things in silos.
Okay.
So everyone, as long as it's appropriate, deserve to know what's going on.
Hmm.
You know what I mean?
Yeah.
So if with with social media, with our presence to the outside world,
Hmm.
right? Because it's not just social media, it's also how does your website look? What is on your site? What is your overall digital presence?
Hmm.
And is that being tracked? And so that's one of the things that I've tried very hard to do. So one of the things that we've added is news and media to our website.
Okay.
So that way
Cool.
people can see on a tab on our website that, you know, these are our efforts.
Hmm.
So for instance, when Congress was voting on Medicare, Congresswoman Terry Sewell asked to meet with me and a couple other nonprofit leaders to talk about Medicare and why that would be important to our populations. And so that ended up being on the news. And so I was able to put it on our website and say, hey, these are the efforts that we are making on
Very
behalf of the
nice.
sickle cell
Very
community.
nice. I love this because I've heard like a lot of people sometimes don't feel too confident of donating their money because they are okay. I don't know what they're doing. Yeah, that's their mission, but like, show me what are you really doing. And so this strategy that you just did, it's amazing because then you can go and literally say, what are you guys doing at the moment? So it gives a lot more trust to the people that want to donate.
Exactly. And we have a tab for the services that we provide. We have a community page where we talk about, these are the different pictures of events and things that we've been doing in the community.
Hmm.
We have an events tab so that people can see. For instance, after the walk last year, we launched a whole sickle cell week.
Uh-huh.
So because sickle cell day is June the 19th, um, originally a warrior approached me and said, hey, are we doing anything on sickle cell day? And I was like, well, the staff doesn't get a lot of time off, and that's one of the days that we get off because
Oh.
of Juneteenth. And I was like,
Yeah.
but you're right, we do need to do something. And so I started thinking about, what could we do, and what could we how how could we mark the occasion,
Hmm.
right? And I thought, sickle cell is so complex. We lose a lot of people. It it is a disease where we've had to bury
Oh, wow.
a significant amount of people over the course of our organization, and so we needed a space for grief, and we
Hmm.
also needed a space for doing the best that you can in that moment, and then we also needed a space for hope for the future, and then we also needed a space on either side for joy. So
Yeah.
what was supposed to turn into one day
It's a week.
ended up being a full sickle cell week of
Nice.
programming. So the walk kicked it off on Saturday, and then on Monday we had a Living Well with Sickle Cell Day. One of our warriors, she works for UAB Live Health Smart, so she did a cooking demonstration
Ooh.
with ingredients that can be found in our garden
Oh,
that we
very cool.
grow here. And so people were able to take home produce and go home and try the recipe for themselves.
Hmm.
After watching her do the cooking demo, and then following her, we had a balancing emotional wellness talk. And then the next day, we did a balloon release for our fallen warriors. The day after that, we did a gene therapy testimonial where we're one of the first people to get gene therapy came and gave her experience on
Hmm.
what that was like, the good, the bad, the ugly. And then the following day, we did a fundraiser at Jenny's Ice Cream. So
Cool.
everyone can get ice cream on World Sickle Cell Day and celebrate the people who have sickle cell in their lives, and to do something fun for a
Hmm.
good cause.
Hmm.
And so I think things like that are really important. And it's very different. We actually got onto the national sickle cell newsletter because that type of sickle cell week isn't very common.
Uh-huh.
Um, and
Very good.
so it's
Congratulations.
something that. Pardon?
Congratulations.
Thank you, thank you. we've just tried to do things differently and have the
Mhm.
courage as a team to think about things not as they always have been, but as what we would like them to be.
And that's how you stand out. That's how you grow. Making things
We certainly try to do that.
good. Okay, so you touched about the website part with the very innovative idea of the news, and also some social media. What other types of digital marketing you guys have done or do at the moment?
So we have starred on podcasts,
Nice.
and so that's part of the reason I took this interview today.
Uh-huh.
We have done things like that before. We've also been featured since I've been to so many United Way trainings. They have had me in a couple articles,
Cool.
and my staff as well in a couple articles because of that. So, and then also we involve our warriors. We ask people like, "Hey, can you share our
Mhm.
event? It means so much. If
Mhm.
even if you can't attend, just hit that share button and let people know." And we have a lot of warriors who share our stuff, who share our things across social media, and it really is about how many eyes it gets in front of
Mhm.
sometimes.
Mhm.
We're also not afraid to print out flyers and hand them out.
Good.
uh, for, for the ride for sickle cell. I ended up at a Harley Davidson stunt show on accident, and a car show. And I was just there to promote the cause, just to be like,
Mhm.
hey, if you're not doing anything on Sunday, August 17th, here's a ride that we're doing for charity.
Nice.
And I actually ran into a whole motorcycle club where their whole thing is being charity riders. Like they
Oh,
only ride in
wow.
charity. And I had never known anything like that
Uh-huh.
before. So I think in as much as the digital is important, the face-to-face connection
Yeah.
cannot be replaced.
Yeah. Yeah, and idea is that the digital also brings in a little bit more of that face to face connection, right? Have you
Absolutely.
heard about? Sorry, I interrupted you. Go ahead.
Oh, no, no, you're good. You're
Okay.
good.
Have you heard about the Google Ads grant program?
I have not.
Okay, so Google Ads, you have to apply, but for nonprofits, they have this program called Google Grants. And what they do is that they give you $10,000 of spend for free to do ads for your website. And so it's just a process at the beginning for them to accept you, but as long as like you have all the paperwork, which of course you guys do, they provide those $10,000 for free for the cause. At the beginning, like sometimes it's hard to spend the whole budget because they have some limitations. Like for example, you can only pay $2 per click. But as you work in the account and as you do optimizations and the account gets more history, you're able like every month to be able to spend more and more. So that's
Cool. I'll
actually
definitely look into that.
you should, yeah. I actually manage like two Google Grants accounts for animal rights nonprofits.
Wow,
Yeah.
that's cool.
So it's something that I always, every time I talk, because I've talked with a couple of nonprofits owners and people that work in nonprofits in the podcast, and so I always tell them about that.
Absolutely. I definitely wrote that down. So I will be asking you questions about that for sure.
Perfect. Okay, and what would you say that is the biggest challenge in regards to digital marketing that you guys are facing?
I think, and this isn't exclusive to only us. It's definitely something that I've faced in working with other things
Mhm.
in the healthcare center. But getting things that have a healthcare focus to have traction in the digital world
Mhm.
is a bit of a challenge. And especially when you're a small organization and you don't have a specific department dedicated to media or
Right.
digital presence, social media.
Yeah.
Um, that can definitely be challenging, especially within the bounds of everything else we have to do to keep the doors open, keep
Yeah,
our clients in the best shape that they can be in. So I think that's probably one of the biggest hurdles.
agreed. Agreed. And sometimes also what I've seen is that certain types of healthcare they can have like little restrictions or limitations related to digital marketing. So sometimes you don't have all the full capabilities that you would have with an e-commerce or something like that.
Exactly.
Mm.
And again, when you're dealing with healthcare, you're also dealing with HIPAA, and when you're dealing with
Yes.
rare diseases, it has limitations on what we can do
Mhm.
and how we can present that information. And not everyone with a rare disease wants to come forward and be the face of it. Not everyone wants to
Right,
talk
of
about it, and
course.
that's okay because it can be very painful and traumatic to have to relive
Mhm.
those bad things that happened in your life.
Mhm.
Um, and so trying to work around that has been interesting.
Yeah, and I've also think that sometimes people, even though they're going through a very hard journey, they don't want us like be or show themselves as the victim. And so that's also hard for them to communicate sometimes. So sometimes we think that people are not gonna believe us or pay attention or something like that.
Yeah, for sure. And I think that I think that a lot of people, don't necessarily want the spotlight on them about
Yeah.
one of the, more painful aspects of their lives. Our clients are full people with full lives and hobbies and loved ones and jobs and interests and
Hmm.
education and all these different sorts of identities, and they may not want to concentrate on the one that brings them chronic
Correct. Understood. Okay, Sophia, thank you so much for all of your knowledge. I learned a lot. I didn't know a lot about sickle cell disease, so I love to learn a lot about this. Your expertise is great. So, where can people learn more about you and also about the sickle cell disease nonprofit?
So our Sickle Cell Disease Association, our website is, let me go ahead and look it up so I don't tell you wrong.
Yes.
We are, our website is Sickle Cell, that's SICKLECELL, BHAM, that's B as in boy, H as in happy, A as in Adam, M as in man.org. And that is where you can find everything about us specifically. I would encourage everyone, wherever you are in the United States or abroad, to get involved in your sickle cell disease association, wherever that is. For Alabama, we have 6 different ones across the state. There are many more nationally. So I want to encourage everyone to get involved with their local chapters. As for us, you can also find us on Instagram and Facebook. If you type in Sickle Cell Disease Association of America, Central Alabama chapter, you should be able to find us.
Very good. Thank you so much, Sophia. I appreciate you.
Thank you